Africa's health challenges are as diverse as its people. Tackling them needs coordinated efforts. The Africa Public Health Foundation started operations in a context marked by the devastating COVID-19 pandemic, with Africa Centers for Disease Control and Prevention, Africa CDC, playing a key and leading role in the continent's containment efforts. The situation required an appropriate response from Africa Public Health Foundation to secure funding. Africa Public Health Foundation's mandate is to forge partnerships and mobilize resources to support critical public health initiatives led by Africa CDC.
The creation of Africa CDC was a major achievement in the continent, and there was a major step forward by the heads of state of the African continent, because we have been through bad experiences, repeated experiences of pandemics, other health emergencies, and we were not properly organized in order to get a coordinated effort for the whole continent to deal with these bad situations. And we as APHF were created as an organization to support Africa CDC, mainly to provide a platform for partnerships and collaboration of several partners with Africa CDC, and mostly to mobilize resources for the programs of Africa CDC.
Africa CDC as a premier health agency is there to support the effort of the government to build resilient health security systems in a very unique way, to ensure that each country they have a functional the national public health institutions, which is well equipped, with a well trained, and have the necessary ability to bring all the public health assets in each country into the same platform, with the surveillance of the workforce, research, preparedness and response.
One of APHF's successes was the mobilization of resources that helped different African countries weather the COVID-19 pandemic. In Zambia, APHF supported the efforts of AMREF, who worked with community health workers in stopping the spread of COVID-19.
AMREF, since the onset of COVID, has been partnering or collaborating with the Ministry of Health to support the COVID-19 response. And so in a number of avenues, AMREF Health Africa has also been working with Africa CDC to ensure that the Republic of Zambia is supported in the appropriate manner. And one of the ways that this was done was through the funding from Africa Public Health Foundation, where AMREF Health Africa received funding to support the Ministry of Health in a number of areas.
We supported the Ministry of Health in strengthening our COVID-19 programs in 50 low-performing districts. And the thing that we saw actually is that none of the districts that were in the 50 low-performing at the time were the major provincial capital districts. All of them were rural districts, which showed the vaccine inequity in terms of access amongst communities.
The project supported about 4,500 community health workers to be able to do social mobilization for the vaccination. And also this was mainly to really look at the issues of the myths that were on the ground, to be able to refer people to get vaccinated. And so we saw also those community health workers playing a critical role as the gatekeepers in the community in encouraging people to get vaccinated.
Mu 2021 nambira okuwombaza mobilize COVID-19 nale amanganda do okuya mukubasambirisha abantu afa balingira okuyisunga panshita ya COVID-19. Omulando wakwati balando kwa COVID tatushiboko yafuma tatushobulele buntu ko bwafuma ero futi no muti muletula tatushiboko ufumini bambi balanda tifyafuma kumenshi bambi nabo balando ko batyawo nga mwatulasa mwalasa panga tabika poka coin kala ikatirira takafumulonga nga mabika po baubu yala ikatirira tayafume nokwaka balanda tiyale yaka bambi nabo balanda tinga balasa COVID balerwala balefuna okuya okuli konse. So icho chali challenge yakwati abantu abengi balike nokula senyereti ya covid kuti baishite protect. But tatwalekerapo pene twaleputisha okubasambisha abantu fe balingiro okuisunga ofe balingiro okufora face mask nokuti tabalingiro okulasangwa pa group kuti basobola covid-19. So after balandoka bati kakoini kale katilanga babika apa nali bebero kwati nena alira senyereti mbikeni po nga mulefa mono kuti ngakaka ero nga kwa bali abambya basumino kulasa pala pene twalese ndo kuti legeni tubule kakoini tubikepo tumolenga kala ikata oro tubikepo baubu tumolenga yala ikata. Lero after bamono kuti tafya sumine tafya ikete bolise bali abengi bali sumino kulasanga bamono ko bati tafile chitiko fo bale tontonkanya bati abengi balanda chao tulalwala chama mwala sapo abana ifo fo bakulu twashara pakuti fo bakulu 44 fya kudya fya abana.
So the biggest thing with what is our strategy going to be, and we work for communities, but in this case we worked for and with communities, and our entry point was our community health workers.
So from the time that COVID had emerged, as a facility, we have managed to vaccinate people from 32% to 50% now at the facility and in the community. With that being said, at least the numbers have reduced, the COVID cases have reduced, and then we even have people who are willing to come and get vaccinated at the facility and in the community. So it has been an ongoing process, and I would say the response from the community and the response from the facility as health workers were working hands to, to mitigate the COVID virus.
Kani ya COVID neyamba kwauja abantu kunena kuti balasishe akabilikisha tenani nene zoka mamawa nambupitamo door to door kwamba kwauja kunena kuti tientirase nyereti sati tukokana yai kuti titandizike mukakana kulasa manyereti ne kuti kwala kwaba ni kliniki uchipatala ko mkanilani mukolu talini koma bantu pakumbwa tetyo bekonda kunena kuti tirase koma yakene benzokana bakakana kala papite 2 days nipitilapo soti kanezo tupasa maybe 7 days kuti tipitemo minzi kala basi nikapitilamo nikaambo bauja bala bantu benzomvwesha no lasa so monga muno bali olase natonto tiala bokona ni lokoteni.
I think this is the way we should proceed, that we have to get the continent to take control of its own affairs and manage its own affairs in order to progress.
Africa Public Health Foundation, we are working towards a healthy, productive, and prosperous Africa.